And good morning, everybody. Welcome to Peggy's Place on KGUA in Wallala, 88.3 FM. I am Peggy Berryhill, your host this morning, and the general forager here at KGUA. In the background is Leanne Lindsay, keeping us going, our co-pilot here. And we have a screen full of people this morning. We are live on our KGUA YouTube channel. If you want to check this out, we're going to be talking with several people from the Mendocino County Health Department. Going to get to know a lot more about what's going on in our county in terms of COVID, and looking forward to that. Now, before we get there, though, big shout out, big ups to everybody in California for ending the recall. And we've got Gavin Newsom is, he said some wonderful words last night that it was a win for science. That made me feel really good. It's a win for the people. And he also quoted Robert Kennedy Jr. and saying how he was looking forward to going forward and getting a more gentler time for people. We could all use some gentle time right now. I think we're all pretty well fed up with the anger and the rudeness that's going on. So we'll see how it goes. Even if you didn't vote for him, let's all try and work together, right? Let's try and be together again as humans and move forward, particularly in terms of the pandemic. All right, you guys, I have just a few little local announcements, and then we'll be introducing each one of you. So started yesterday was the first responder classes with the Coast Life Support Organization. They've changed their name to Coast Life Support, dropped the district, Coast Life Support, and they're doing rural emergency medical services training. And those classes, I believe they began yesterday. They're going to be on Tuesdays and Thursdays from 6 to 9. And it'll be 93 hours total. If you want to learn how to help some of your fellow citizens in time of need, we all see those ambulances going up and down the coast. We never know what that means. If you want to be somebody who could help in that area, give CLS, Coast Life Support, a call. And the number is 707-972-6483. And we might be here at KGUA starting a collaboration with the Coast Life Support folks. And I think that would be a great thing for all of us. For those of you who have had to be carried somewhere back and forth, transported in the ambulance or by air, we're going to be learning more about that. This Saturday, September 18th, Coast Cleanup Day. Yesterday, Leanne did a great show with Mendocino County about volunteering, and Saturday from 9 to noon, you can help clean up the beach and the river. And you can call the Mendocino Land Trust if you want to become involved. And that number is 962, area code 707-962-0470 to find out about how you can help clean up our coast and our rivers. Let's see, a couple more announcements, guys. Tomorrow is the free vaccine clinic at Stewart's Point every Thursday from 8:30 to 12:30. That's at the corner of Skag Springs Road and Highway 1, right across from Two Fish Bakery. Most people know where Two Fish is. Dr. Jennifer Francott will there. You don't need an appointment, but it'll be a first come, first served basis. And you can get vaccines and deworming for your pets. Let's be clear. Heartworm and tickworm testing, and microchip placement, nail trims, and other things. The Sea Ranch Thespians' latest play, it's been a while since they've had a play at the White Barn. Other Desert Cities begins on the 16th, going through the 19th. That's this weekend and the weekend following. Free admission, but you have to call and arrange for a ticket. You can contact online searanchthespians.com or call 785-2548. 785-2548, or go online to SeaRanchThespians.com. Tickets are free. It's always a good show. And what else? We have an art opening, art fans. There's an art reception today at Think Visual in Point Arena, featuring the works of Dustin Gayer Smith. That'll be on exhibit from 2 to 6 today. And just a short reminder, and we'll be telling you more about this as we get closer, but next month, we're a little bit out, more than a month out, our Ocean Life Symposium. An amazing time to hear from experts from all around the world about the health of our oceans here and everywhere else. And since we live right here at the coast, we want to help you understand about the coast, all the coasts and the health of all the animals in there. Whew. All right, you guys, you ready? Everybody taking smiling there. Come on now, you can all smile. There you go. It's all right. We have several guests this morning from Mendocino County Health. Did I say Mendocino? I did, didn't I? Mendocino. I'm sorry. Mendocino. Right here. We are across the bridge. Mendocino County Health Department. We have Jessica Tosti. I hope that I'm pronouncing that correctly, who is a communicable disease nurse, and she's been leading the vaccination program. Jessica, raise your hand so I'll know which one you are. Okay, that's what I thought. Hi, Jessica. Kirk Ford. Kirk, which one are you?
Good morning.
There he is. Good morning, Kirk. Environmental Health Hazmat Program Manager, COVID Department Ops Center Chief. That sounds like a lot of hats to wear.
More hats than heads.
Donna Schuler, who is the acting program director. Hey, Donna, I see you down there. And 2 other people, I'm not sure who they are. So we'll let you introduce yourself. How about this gentleman up here in the corner?
Hello, my name is Char Mokel, and I'm the Mendocino County Public Health Public Information Officer.
All right, thank you. And you, ma'am, Miss?
Hi, I'm Jessica Espinosa. I'm just here for added support.
Added support.
Yeah.
Thank you. I can always use extra support. So
You're welcome.
Well, all right, Jessica, I'm sure you're there for more than that. So this morning we're going to talk about several things related to the pandemic, and you guys have been so busy. We also have to are sorry that Dr. Corin wasn't available with us this morning, but we've got so much information, and I believe Jessica is going to start out and talk about the vaccines. Is that correct?
Yes.
All right, go right ahead. And by the way, I want to remind you, you can also see all these lovely faces on KGUA's YouTube channel right now.
All right, so again, good morning. My name is Jessica Tosti. I'm the acting program administrator for communicable disease and immunization at Mendocino County Public Health. I've been involved with this program the entire time during the pandemic. So I've been through all of it. So it's been quite the journey.
And it's not over yet.
Right, yes. I would like to talk about and give some information about the 3 different types of vaccines that we do carry here at Public Health. We carry the Pfizer vaccine and the Moderna vaccine. Both of the vaccines are mRNA vaccines. The Pfizer vaccine is currently indicated for patients 12 years and older. The Moderna vaccine is indicated for people 18 years of age and older. And the 3rd vaccine that we carry is the Janssen vaccine, which is a viral vector vaccine. And that vaccine is available for 18 years and older. The Pfizer vaccine the Pfizer vaccine is a 2-dose series, and it is separated by 21 days. So to be completely immunized with the Pfizer vaccine, you need 2 doses, 21 days apart. The Moderna vaccine is also a 2-dose vaccine. To be fully vaccinated with the Moderna vaccine, you need 2 doses, separated by 28 days. The Janssen vaccine is a 1-dose vaccine, so you only need 1 dose of Janssen to be fully vaccinated.
Can I ask you a question? Often comes up, you mentioned that the Pfizer and the Moderna are mRNA. What does that mean?
Coronaviruses like the one that causes COVID-19 are named for their crown-like spikes on their surface called spike proteins. These spike proteins are ideal targets for vaccines. Messenger RNA or mRNA is genetic material that tells your body how to make proteins. So the vaccine is made of mRNA wrapped in a coating that makes delivery easy and keeps the body from damaging it. The vaccine teaches your cells how to make copies of the spike protein. So if you were exposed to the real virus later, your body will recognize it and know how to fight it off.
Okay. Just again for the audience to the mRNA is quite people are quite suspicious of that are teaching our body to do something, I guess. And yet this isn't really new technology, is it?
No, you are correct. And the vaccine does not contain any virus, so it can't give you COVID-19, and it cannot change your DNA in any way.
Well, that's good.
Yes.
Cannot change our DNA. Our DNA is there any, so our DNA it's set when we're born, comes from our parents, grandparents, and wherever, right?
Yes. So basically the mRNA delivers the instructions and your cells break it down and get rid of it.
Wow.
It's telling your body what to do.
Great. And it's been pretty effective, hasn't it?
Yes, it has.
Okay.
Yes,
Great. Now, in terms of the potential updates, the booster shots, is that going to be happening, or am I getting ahead of us here?
So additional doses are not boosters. So currently, an additional dose, which is a 3rd dose, is recommended for immunocompromised patients. And a booster dose is not yet authorized or recommended. And a booster dose should be 8 months after your 2nd dose of vaccine.
But they're not yet recommended.
That is correct. It is not yet authorized. We're hoping soon, hopefully maybe the end of September, the beginning of October. But we are currently giving out additional doses for the immunocompromised patient. The public health officer asked that you bring in a note from your doctor stating that you do indeed need the 3rd vaccine, and we will give that to you.
Now, a lot of people are concerned about the side effects of these vaccines. And can you address that a bit? I often look at this in terms of math. I mean, math is math. It doesn't lie. And if you look at the millions of vaccines that have been given globally and the side effects, they're pretty tiny. Again, I'm just talking about math and science, something that is tangible. There's really no way you can argue with 1 + 1, is there?
The side effects have been pretty mild. We've seen pain, redness, and swelling in the arm site, which is not uncommon. Mm-hmm. And then throughout the rest of your body, you may see tiredness, headache, muscle pain, chills, fever, nausea. But again, it is mild compared to what would happen to you if you got COVID. So I would much rather have mild tiredness, headache, muscle pain, chills, fever, nausea, or a sore arm.
It's exactly certainly a different generation than all of you on the screen. And I'm of that generation where we were lined up to do tubes, and we got, shots and for smallpox and measles and all of that stuff. And so we kind of got used to having that done in groups, and, the sore arms. And of course, as you grow and you get immunizations for this or that, there's been some talk about, again, if I'm getting ahead here, just tell me and we'll back off here, but of combining in the future the flu shots and the COVID vaccine shots as one in the future. Is that still is that in the forecast?
I have not heard that, but I do know that you can co-administer the flu vaccine with the COVID vaccine. So we will be recommending that when the flu vaccines become available.
Okay, and that's coming up pretty soon, isn't it? Flu vaccine season?
Typically in the first week of October. Wow,
that's soon. Okay, great. Jessica, what else do you want to tell us about?
Is this a good time to mention our website where you can sign up for the COVID vaccine? If you go to
it's a good time.
county.org, we have our dates and locations listed. It tells you how to sign up for the vaccine. We are now offering COVID vaccines at our Fort Bragg office on Mondays. You can go on our website and sign up through My Turn. We are also offering vaccines at our site in Willits, Mondays and Wednesdays. Again, you can go online and sign up. And we continue to offer the vaccines at our site at the Ukiah Fairgrounds on the Fine Arts Building every Friday.
Great. Well, I'm really interested, as I'm sure our audience is. And by the way, you're listening to Peggy's Place on KGUA in Gualala. You might be listening on one of those quaint little devices called a radio at 88.3 FM at home or in your car. You also can get this on the TuneIn app, Radio Garden. And if you go to kgua.org, you can download our Air Pocket app and take us with you anywhere. And a lot of our fans carry us with them while they travel around the country or the world. And of course, now our wonderful KGUA YouTube channel. So Kirk, can you talk to us about the latest data on in Mendocino County with our cases? And sadly, I think we had 2 recent deaths as well.
Yeah, absolutely. I could share some of that information. Before we get too far off into that, I wanted to kind of dovetail into what Jessica was mentioning about vaccinations and our website. If you didn't get that website, it's mendocinocounty.org/COVID-19, and there's no dash between the COVID and the 19. And that will take you directly to our COVID page. You won't have to kind of futz with all the other stuff that's on the county website. Direct to the COVID information. There's a blue box at the top that talks about vaccines. You click on that and it takes you to a whole host of things. And you can see where the vaccination clinics are. You can also get more information about third shots, booster shots, confirmatory tests, those types of things. And also, one of the big plugs is pharmacies. You can almost, if your pharmacy sells drugs, it probably has a COVID vaccine available. So instead of driving all the way to Ukiah or driving to Fort Bragg or going anywhere outside of wherever you are, check your local pharmacy. You might be able to get the COVID vaccine and even the third shot or booster when it comes out at your local pharmacy, as opposed to driving inland. So that's something we definitely want to push to make sure everybody knows about, because it's a great resource.
Does that include commercial pharmacies like CVS? Or
Absolutely. Yeah.
Costco? Okay, That's really, really helpful. And, sadly, our community is losing our pharmacies. So,
oh no.
I know it's very sad for us. But anyway, there are many, many other ways to get the shot aside from also our local clinics that happen. Thank you. So why don't you give us update us with some current facts from Mendocino County?
Sure. I've got some, I'm not going to, screen sharing is disabled. So I guess I'm not going to do some screen sharing, but I can talk about some of our vaccine data. This last week is one of our lower weeks for vaccination. We've had only 68 new vaccines in arms this week, which is down from 111, which was about this time last month. So we're seeing a decreasing trend countywide as far as COVID vaccines, which is consistent with a state decrease as well, from about 46,000 this time last month to 28,000 this month. So we're seeing a decrease that's consistent with the state decrease. And then our second dose is kind of trailing along behind that, because as Jessica mentioned, it's 3 weeks for a Pfizer second dose and 4 weeks for a Moderna second dose. So there's a little bit of a lag for when those show up. As far as the number of vaccinated, we've got just over. Oh, and my website's closed. Well, I can give you updates on the zip code for 95445. All right, that's where most of your listeners are in. It's currently sitting at 76% vaccinated for your specific zip code. And that's fully vaccinated. That's folks who have had both shots and 2 weeks after the second shot. So that's higher on the average countywide. That's slightly higher than our average, which is right around 65-66% of fully vaccinated folks. So that's good. It means you have more protection and more coverage. And I can't show that one either because I can't do a screen share.
Screen sharing is on now.
Oh, we have screen share. Excellent.
Screen share, yes. Thanks to our co-pilot out here.
All right.
So
here we go. We're going to go to a little presentation here. So this is some data that's from California Department of Public Health. They put this data out weekly. It really is meant for internal use, but there's such good information here that it's really worth sharing. And we share some of this information on our Friday media days. If anybody wants to watch the media stuff, or if you guys would like to participate, it's every other Friday. And Trevor, who's here with our communications group, can definitely give you all the details about how to get in touch with the media team to get on that. And that way you can ask direct questions of the health officer. You can get the most up-to-date stats on case rates, vaccinations, and any new information. So I highly recommend either folks to tune in or be a part of it. And we'd love to have KGUA on there as well. So some of this data is presented at those media days, but this is most recent information that we have for this week. So for the radio listeners, what I'm showing here is a bar graph or a line graph that has two lines on it. A line at the top, a solid line that shows a big peak, and then a smaller dotted line near the bottom. And it really shows the gap between the case rate. These are folks that are getting sick, getting infected with COVID and testing positive. That's the case rate line that you see. And you can see that we had our big Delta surge here in August, and we're starting to see that kind of trend downward. And you can see that mostly the people who got the infection were those that were unvaccinated. There were some that were vaccinated, but compared to the unvaccinated, it's just a drop in the bucket, and it wouldn't put nearly the strain on our hospital that the unvaccinated are currently having with the excessive amount of infection and hospitalization that's required. And then moving on to, go ahead.
I was just going to ask you about that, about hospitals and how they're being overwhelmed. I understand for some surgeries, they're being pushed off 6 months into the future because of the amount, and in particular, the unvaccinated who are overwhelming the hospitals.
Yeah, then that's correct. There's a large amount of folks that are very, very sick that are in the hospitals, in ICUs. Our ICU capacity has been below 25% for the better part of a week and a half. And the last couple of days this week, we've had ICU capacities as low as 0%, which means no ICU beds are available for folks that are sick. So when that occurs, we have to look at the in-network hospitals and try and transfer out folks so that we can free up bed capacity. And we do have a couple of beds available today in our ICUs, but it's definitely lower than where we'd like it. And a lot of that has to do with the folks that are going to the emergency room that are very sick. Now, if you are very sick, still go to the emergency room. We still want you to go. We don't want you to stay at home and just try and tough it out. It doesn't work well. If you're having difficulty breathing, if you're having really severe symptoms, go to the hospital, get checked out. if it's something that's very critical, we'll try and find a location where you can be, where they can provide care. We'll work on that on our end. That's something that's happening on our end, but we just be patient because we do know that they are heavily impacted, and then they can also get you different medications that can help with that.
Okay.
So that's, but yes, that's kind of what we're seeing here. This is our hospitalizations, very similar to our case rates. Also notice the down there at the bottom, the dashed line. For those folks that are vaccinated, it's very low, the case rate below 0.5 per 100,000. And this is statewide data. So it's a much larger data set than just looking at Mendocino County data. And then the next slide is showing our ICU status by vaccination, which is less than hospitalization, right? Because you have a less chance of being severely infected. That you need ICU as opposed to just hospitalization. So as we move along, the rate gets lower and lower between cases, hospitalizations, and then ICU. So our ICU status for vaccinated versus unvaccinated. Unvaccinated folks, it's about 0.6 per 100,000. And for vaccinated folks, they're at 0.05 per 100,000 folks. So it's very low, very, very low for folks that are vaccinated to be in the ICU. So the best recourse you have to stay out of the ICU, stay out of the hospital with COVID is to get a vaccine, because it protects against the severe sickness. And then this is I love this slide. It's a fantastic slide. It's a graph that shows three trending data for vaccine effectiveness or efficacy. The top line is the red line, and that's deaths. And it's running right around 97%. So what that means is that if you get the vaccine, there's only a 3% chance, according to this, that you'll die if you have gotten the infection, gotten to the hospital, and are checked into the ICU. It gets lower and lower and lower each time. And it's showing how effective the vaccine is at preventing and protecting against death. The next line down, the blue line, coming in at right around 90% is hospitalizations. It's going to protect against hospitalizations 90% of the time for folks that are infected. So those are folks that are infected and are sick enough to go to the hospital. And then the next line down is that green line, which is showing right around 88%. And that is protection from getting the virus to begin with. So, and each one of these stack, right? So even though it looks like they're combined there for the ease of providing the information, but they stack one on top of each other. So there's an 88% chance that you're never going to get sick, and if you do get sick, then there's a 90% chance that you're not going to go to the hospital, and if you do go to the hospital, there's a 97% chance that you're not going to die. So each one of those stack one on top of each other. But it just shows just how effective the vaccine is at preventing illness and death for COVID. It's so great to have this kind of data. And this is a large data set, right? This is California as a whole. It's not necessarily world data that we're seeing everything, because the variants are different depending on where you go, but this is California. This is kind of right now. You can see April, July, we're on here. This is now, this is live data. This is from the state, and it's showing how effective it is. And it's one of those that I just absolutely love it. And it's a really, I'm sorry. I didn't quite hear all that.
All I'm saying, Kirk, is that does bring us up to date, including the Delta variant.
Yeah, that's correct. And speaking of the Delta, most of the cases that are getting whole genome sequenced, which is where they take the person who's positive, they take it down to the lab and they kind of pull apart the virus and they try and get a genomic sequence on it. They're seeing Delta, 100% Delta, or very close to it in the state. There aren't very many in Mendocino County that we're able to sequence. There are some that we are able to sequence. It's really determinant on lab capacity, and we're in a very rural area that it's a little bit more difficult to get lab data focused on our whole genome sequencing. But we are seeing Delta just like the rest of the state. It's almost entirely Delta.
Yeah, one more question. I'm going to have to take a short break, but what about, I can't think of the name of the newest variant that is being talked about.
I think that might be Mu.
Mu, I think it's Mu, yes.
Yeah, there's, I haven't heard too much about it. They were speaking a little bit about it last week on our California Department of Public Health statewide call. They're at this point, they're just kind of looking at it. It's hasn't graduated, so to speak, to a variant of concern, meaning that it's going to be something to really watch, that it's more infectious or more damaging or worse in some way. I haven't heard that. Granted, our updates are usually Wednesday evening, so we'll find out more tonight on what the new status of Mu is. But yeah, that they're watching it. People are looking, and they're keeping track. But right now, we're still very much in the land of Delta.
Amazing. Thank you for this. Let me remind you to KGUA in Wallala, perhaps at 88.3 FM. We are also tuning in. Radio Garden, our Air Pocket app, and some of you are watching us on our KGUA YouTube channel, and let us know that you're there. We'll be monitoring that too. We're talking with Mendocino County Health Department experts today on the virus, of course, the what's going on with coronavirus in our county, and talking about the importance of getting vaccinated, because the most simple way to protect yourself and others is getting that vaccine. Of course, wearing the masks, continuing to wash your hands. And yes, we're all tired of it. But, you know, the fact that we're saving lives is so important. And the fact that we are, at this point, keeping the numbers as low as we can. And that's what's the most important thing. I think it's hard for people sometimes to fathom that this is a global phenomenon attacking humans. And it hasn't happened in any of our lifetimes, something like this. And when the Spanish flu happened, there was not the kind of media, the kind of way we could communicate from nation to nation and person to person like this to help protect each other. So, but people did what they were supposed to do, wear masks, and it helped. So here we are at a more wonderful age, and with all the data that's coming along. We're going to keep talking to some of our friends here from the county. Let's see, we've talked with Jessica, and we've talked with Kirk. Donna, you have Donna Schuler, who is the acting director. She has some current vaccine information and more about your YouTube channel. And we congratulate you, by the way, for the work that you and your teams are doing. These are just a few faces of the people working in Mendocino County Health. And before you give us the information you want to share, Donna, how are your teams holding up? Because it has been some days, almost 24 hours of activity going on. Other days, people get a little bit more rest and time to catch up. How would you describe what's going on with your county staff?
Thank you, Peggy. To clarify, I'm the acting program administrator in accreditation and quality improvement. I'm not the acting director of public health.
Okay.
Our transitional public health director, though, you may have heard, is Ann Molgard. And she's wonderful, and we're really glad to have her. I would say that to answer your question about what is happening with our staff is, yes, we're like everybody else. We're tired of it. We want to end the pandemic. We'd like everybody to be vaccinated. But we are hiring, and we have more staff. And so we're spreading out and developing a different kind of distribution of work in different specific units of COVID, vaccination, things that really weren't in place, even though public health is known for doing vaccinations. That's a lot of people think over the years. It's like public health does flu clinics, or they historically have done the polio clinics for kids, or whatever it was. That's what people thought about when they thought about public health historically. a lot of that work has shifted over to our clinic partners over the years. But now here we are again, right, with our clinic partners dovetailing in to make sure that we get enough vaccine coverage across the county. And I really liked your introduction today, Peggy. I want to, even your announcements, it just shows like everything from the EMS, arts community, all that is just kind of like we're all dovetailing in, and we're going to cover this across the county by working together with all our partners. So I really like the way that you have brought that into this program and into all your programming on KGUA. So thank you for inviting us here today.
Thank you very much. Well, that's what community radio is about.
Yeah. Absolutely. I love it. I think you may have picked up some new listeners and viewers today because this is a really great program. I know that when I learned about KGUA, we can't listen in Fort Bragg, but I learned about streaming, and now you have your pod, the mobile pockets and all these kind of things. So it's a lot easier for people in our county to tune into KGUA than historically it has been. So all of us, like you say, are using the media in better ways to get the information out. And yesterday, our county health officer, Dr. Andy Corrin, did a really excellent presentation to the Mendocino County Board of Supervisors. And I want your listeners and viewers to know that they can go to the Mendocino County YouTube channel and view that, and then look at some of those data slides and listen to the information coming from Dr. Corrin. Just as Kirk was describing a few of those slides, there's more information, and that is on the Mendocino County YouTube channel. And at this point, I should probably hand it over to Trevor, who can probably, if he's allowed to screen share, he could probably show people that are viewing, but also describe to our listeners how to get that information, because I really think the COVID banner on our county webpage is the place to go. It's where I go because the information is changing so rapidly. Each week we have to keep up on where the next vaccination clinic is going to have. And before I hand it over to Trevor, I'd like to say that we have the fair going on this weekend, the Mendocino County Apple Fair. And
really?
Some people are going to be staying away, and they should if they are, vulnerable and whatever reason. But we do have kids that have been, raising their 4-H and future farmer projects and doing things all year round. They are going to be on display, and people can go and be safe. But there's a vaccine event going there too. So Jessica will probably speak more on that. That's going to be a great event paired with the Apple Show in Boonville. So Trevor, if you would please show some of the places people can go and get that information.
So I won't exactly screen share, but I will give you guys the information. So we have our Mendocino County Public Health Facebook page, which we post a lot of information that you can find about vaccine clinics, new information from CDPH, which is the California Public Health Department. We also have our Mendocino County Facebook page. And we have our Mendocino County media update that happens every 2 weeks. We're actually on an off week this week, but next week, the 24th, Friday, we will be hosting a media update with Dr. Corrin, where we have various media sources from around the county. And then also we take questions from social media and answer them live on air. So if anybody would like to participate in that, you can post comments in the live stream on the YouTube page, as well as on Facebook. And we will be watching them and taking notes and talking to Dr. Corrin and passing them along.
Great. That's a wonderful, wonderful service. And we're going to have to get ourselves on board with that too.
We'd love to have you.
So, and what else? I mean, Trevor, your job, in media, at least we always see that media officers are inundated with all kinds of requests. What kind of requests are you getting and from whom?
So I think that the most of what we are coming across is just people that are nervous about the vaccines and whatnot, and just kind of like helping people understand that the vaccines are safe and that you can be helped a lot by getting your vaccine, and kind of reaching those people that haven't necessarily been reached yet. So it's mostly at this point the people that are worried about it that we're trying to talk to, and really just trying to help them come to a place where they can feel comfortable and we can help them.
I'm glad you brought that up. How do we help people that are so nervous about the vaccines? I just in general nervous. I don't want to get too far gone on the people who are extreme, but just people who are nervous in general. How do you talk to them? How do we talk to them?
Well, I think outreach like this is what we're trying to do, is just speaking to people through trusted media sources and also having good information. And like Kirk was sharing earlier, all the data that we get from California and everything else, just sharing that information and trying to get it out there so that they can actually look at it and make the decision for themselves. Because ultimately, at the end of the day, it's their decision. And we can just present them with the information.
And to add to that, it's really about the interpersonal relationships, right? So we as the county have tried really hard to put as much good data out there so that people can make an informed decision. But when it comes to somebody who's very hesitant or very reluctant, it really comes down to, are you vaccinated and is your friend not vaccinated? Then we want to give you, the vaccinated person, the information that you need, that you can talk to your friend and you can, or your loved one or your family member, and have a strong argument for why they should get the vaccine, because ultimately it's going to be on you to try and convince them. We can't go out into the streets and hold people's hand and let them know that, hey, we're telling you the truth. This is actually a real thing. It's very severe. Please do this. It's going to be up to you. It's going to be up to you, the listeners, to have that interpersonal conversation with your friend or loved one to convince them to get the vaccine and explain to them. And we want you to do that. We want you to do that with as much good information as we can provide you. So this data that we're presenting, it's not necessarily for the unvaccinated to hear the data from us. We want to equip you. We want to equip you, the vaccinated person who is a vaccinated champion, to go out and talk to your friends and loved ones and with the information that we're providing, so that you can make a compelling argument, that you can say, no, look, here's the data, and the things that you're seeing on TikTok or the things that you're seeing on Facebook aren't necessarily true, because this is the true source, and this is what I'm finding out about this information. And look at the data set that is so large, and that the amount of people that are having a really harsh symptom is such a small minority, that it's still very safe. Go get it, because I don't want to see you in the hospital, and I don't want you to have difficulty breathing or have long COVID or these things. So that's one of the reasons why we share this information, is so that the listeners can make that argument to their friends and loved ones.
Well, I think it's all great advice, but I will say, Kurt, not everyone is when it comes to seeing a graph and data can look at it and say, as you did, I love this graph, I love this chart, but the information and how to decode that is so important. Donna, I see you raising your hand. Go ahead.
Yes. I'm one of the lucky people that gets to make contact tracing calls from our public health department. So I actually do the case investigations and make the contact tracing calls, and sometimes get to close the cases. And I would say, from the perspective of somebody who closes the cases, many of the cases who I speak to are people who have been hospitalized. And you better believe they're asking me, how soon can I get my vaccination? Unfortunately, is that what it takes? People to become, that have not been vaccinated, that are just getting out of the hospital this week, to be asking, I'm going to get it. I never want to be that sick again in my life. I thought I was going to die. I mean, this is the kind of thing that I'm hearing from the cases I'm closing. And then from the other people, there's people that are vaccine hesitant, that were just waiting maybe for that FDA approval. So now we're seeing a lot more people lining up to get the vaccine. A lot of people were really waiting, that weren't trusting it, because this was a new vaccine. So now that we've had the approval, I want to, clearly say that we're seeing an increase, even though overall, like Kirk says, the rate of people going for the vaccines may be dropping slightly. There has been an uptick that I'm seeing locally, well, here on the coast. So maybe certain regions need to get more vaccination. And I think maybe Kirk can speak to that, or somebody else, about around the county, we have different areas that have very high vaccination rate. If you look at the swath of people from the population stretching from the Anderson Valley all the way over to the coast to Mendocino, you've got 99% and 90% of the vaccine eligible population vaccinated. And then we have some certain pockets that are in the 40s. And I'm not sure if the data is somehow skewed there, but we have some populations, certain zip codes, and you can go look at that on our county webpage that I was talking about. You go to the COVID banner and scroll down on the vaccination page, and there is a map that shows that. So that is the population of people that are hesitant, but some of them are probably won't get vaccinated, but some of them will. And that's who Kirk was addressing, that for the people that are vaccinated, to get the accurate information out to the people that are kind of on the fence, but they're a little nervous, or they're kind of sticking with their group. They can break ranks, and they might break ranks. And that's what we want them to know, that it's confidential. And that's what I have to say about that right now. Thank you.
Thank you. And before I get to our next hand up, I love this. Everybody's anxious to talk about this. I'm just wondering, while we're talking to Jessica here, Kirk, if you were, since you can screen share, could you bring up that county website that Donna was just talking about? And we'll get to that in a moment. All right. It is your time to comment on us.
I just wanted to add that at all of the vaccine events, my staff is there and willing to take questions and step aside and talk with you about any fears or hesitancy about vaccinations. And just to add on to what Donna was saying, we will be at the Mendocino County Fair and Apple Show this weekend on Saturday and Sunday. You can approach us. We will answer any questions that you have about the vaccines. If you receive a vaccine on the Saturday or Sunday, you get free entry into the fair.
Wow. You know, I'm so glad you're bringing that up, not just because of the vaccines, but to remind people that we can continue to live life. We can go outdoors. We can go to fairs. There's, you know, sports complexes are starting to open. They're going to be very strict, which is good. But we have to have a sense of normalcy. We can't just continue to either just be separated and isolated. That we've all felt the effect of that, and now the when there is time that you can be with other humans, we have to be with other humans. It's just how our nature is. That is part of our DNA, but you can do it safely. And I think things like the Apple Fair, outside, always fun, these rural communities, it's great. So there are a lot of things that we can do cautiously. There are some things that probably don't want to do or that can't be done as safely. But as long as we're working toward safety and doing what we can, I think that's important. It's been very, very hard, particularly for seniors and for rural seniors who are isolated, or some communities that may be sort of among themselves, isolated off to themselves, not have the resources to get together. And there's a whole lot of things that are acting, you know, in our communities. And again, I just have to emphasize the globalness of this and why it's so important. Well, where are we going next, Donna? We have about 8 minutes left here, and we want to get as much information out to our audience. And I did ask you, Kurt, were you able to bring up that website?
Yeah, sure. Let's do that. Let's do a little screen share.
For you people who are watching us on YouTube, if you're not watching us on YouTube and you're listening to us, you will be able to go after the show to KGUA YouTube and watch this. All right. So what are we looking at here?
All right. So this is the Mendocino County coronavirus landing page. So there's a couple of ways to get here. You can type in mendocinocounty.org/COVID-19 and go directly here. Or you could just go to our main page, mendocinocounty.org. And then at the top, you'll see this orange banner, this kind of pumpkin colored banner. And there's a couple of real quick links in here. The top, it says click here for COVID-19 information. If you click that, you'll show up directly on this page as well. And then there's also one for drought and water, as well as the Hopkins fire, which is most recently happened on Sunday. So there's information for that for folks who lost their homes. So if we click on the first one, it brings us right here to this page. This is the landing page. And then on this, we have a couple of different things to look at. First and foremost, predominantly displayed is the vaccine information, which is kind of what we've been talking about in that blue box. Then we have these buttons for news, testing, if you want to find out where to get tested, when you'd like if you're looking for testing, where our mobile clinics will be, our mobile testing locations, your local clinic, that information is in the testing button. You can contact us. You can look at other state resources for data and where we're pulling information. Anything in Espanol that you need, we have some resources there. We have local resources which point to our local partners. You can also check out our most recent health orders, in the red there, which Dr. Corin has put out. I think the most recent actual order would be the masking order, and then frequently asked questions. Case data is where we try and post our data that you see. You might see that on Facebook or Twitter or a couple other places that public health posts their data. If you're looking for like the number of hospitalizations, the number of cases, daily case rate, can be found under case data, and then anything that's older we put in the archive or other notifications. So that's our COVID-19 main page, and we're going to click on this top button for vaccine information, the blue box, and it brings up 3 more buttons for vaccine clinics, frequently asked questions about the vaccine, and any additional resources. And this is kind of the page that I was looking at earlier about some of the information we have about vaccines. And as Donna was correctly pointing out, there's a map down there at the bottom showing Mendocino County and the vaccination data of Mendocino County. That map is actually just it's a static map. You have to click on it in order to actually go to the website. It's a state-run website called a Tableau. It's a software that the state is using to communicate data where they can dump it all in there. So I'm going to click on that, and we're going to go to the public-facing Tableau data set, which shows all of California. And then there's a little drop-down that says Select County. We're going to go ahead and select Mendocino County. And you can see a highlight there. I'll just kind of zoom in to Mendocino County. And so you can see, oops, let's see, we're going to try and move it here. There we go. All right. You can see all of Mendocino County there. And the darker orange has a higher percentage of population that is vaccinated. This is based on zip code data, and it's based on the zip code that someone put down when they got the vaccination. If they did not put a zip code down when they got their vaccination, their data will not appear here. So it's not perfect data, but it's a reasonable view of what we have at a high level. And you can see, as Donna was rightly pointing out, that there's a high percentage of folks that are vaccinated in the coastal areas. The majority of our folks inland have a lower percentage of being vaccinated. So if we click on, let's see, we looked at 95445. If we look at 95468, it's actually showing that 80% of the population based on the census data is vaccinated in 95468. So it's slightly better.
Arena? Is that Point Arena? Mm-hmm.
Yeah. But if we go over here,
Point Arena.
yeah, absolutely. If we swing over in the valley someplace, we'll look at Ukiah. It's showing 72%, and that's going to be this data has to be part of the partially vaccinated as well, because I clicked 1+ dose vaccinated instead of fully vaccinated. So that's why my data set is a little bit higher than what we were talking about earlier. There we go. 61% in the Ukiah area compared to, we'll go back to the Point Arena one, 66%, and then Wallala 76%.
Right.
So that's fully vaccinated.
Because of time constraints, I'm going to ask Kirk, we're going to have to leave this behind, but thank you for sharing that. Donna, we also had information Jessica Espinoza wanted to share with us. Is she still there?
I think it's Jessica Tosta that might have a little bit more vaccination information. Unless Jessica Espinosa has something.
I'm still here. No, I didn't have anything that I wanted to share today. Sorry about that.
That's okay, Jessica. I wanted to make sure that if you had something to share, you get your chance. Okay, Jessica Tosta, what was it that you wanted to share?
I just wanted to just thank you for having us for having me. And please get vaccinated. They're safe and effective, and now's the time. And we'll be there. We're here for you with any vaccine questions. My vaccine team is here for you to support you, answer any questions, and get you vaccinated.
Excellent. Excellent. Anybody else have anything else to share? Trevor, anything for you?
Just thank you for hosting us, and thank you for having us on. We're very appreciative of that.
All right. Well, we still have a few minutes left, Donna.
I can't end this program without thanking our community partners at all the clinics. I mean, that vaccination rate that you see, that those swaths going through, that's a coordination of many people and many entities, including all of our rural health clinics and our federally qualified clinics. They've been amazing. That's why you see those vaccination rates. They're working really hard. So I want to thank our community, our partners in all the clinics. In fact, yesterday, there was voting happening at our Veterans Hall where we usually do our testing right here in Fort Bragg. And we were moved out. The testing site had to move out. So we asked Mendocino Coast Clinics to supply us with some of their pop-up tents. So I ran over there in the morning and picked up the tents and brought the tents over to the grounds at Bainbridge Park. And they were utilized. They did like over 350 tests there yesterday while voting was going on, while other stuff was going on in a hub of activity. And when I brought them back to Mendocino Coast Clinics, they had an active vaccination clinic going on. It was really, and I knew a lot of the people working there and showing up. It was just like really community. I felt great about it.
That is awesome. And I'm so happy to see how Mendocino County is doing. I know I've only got a couple of minutes left. And so, but I do have to ask, in terms of our Native communities or Hispanic communities, we didn't have any breakdowns by ethnicity. Do we know how well those communities are doing, or do they need extra support or encouragement?
Yeah, for the sake of time, we won't get too much into it. Dr. Corin goes into a little bit more detail on his report to the Board of Supervisors on Tuesday, referring to racial data, vaccine distribution, quartiles, and diversity, equity, and inclusion. So if anybody has more information or more questions about that, I would definitely recommend checking out the YouTube link for the Board of Supervisors from Tuesday, and that would be the 14th.
Great. Good information. Anyone else? We've got about a minute left here. We've given out the website. Again, Kirk, give us the information. I mean, again, Trevor.
Yeah.
Yeah.
MendocinoCounty.org /COVID-19. And if you're not quite sure which one the / is, because I get them confused all the time, picture a little person looking to the right? We read left to right. So picture a person looking to the right, the way we read, and is he falling forward or is he falling backwards? So we want / COVID-19.
Is it, after all these decades of, working with the internet, we finally get a really simple explanation like, is he looking forward or falling backwards?
That's why we love Kirk. He has all the explanations and all the data.
We love that. Well, I think we're gonna say goodbye to, and I'm gonna mess everybody's names up. So, starting with Trevor, let's hear your name and what you do again.
My name is Trevor Mokel, and I'm the Public Information Officer for Public Health. Thank
you for joining us. Kirk?
Kirk Ford. I'm the DOC manager for the COVID incident.
DOC.
The Department Operations Center, which it's kind of like the EOC, but in a public health department.
Okay, thank you. Jessica?
Jessica Tosti, Acting Program Administrator for Communicable Disease and Immunization at Public Health.
Thank you. Jessica Espinoza? Okay.
Jessica Espinoza, and I'm on the COVID response team. So I go out and help do the mobile vaccine clinics.
Well, thank you so much for joining us today. And Donna?
Donna Schuler, Mendocino County Public Health Program Administrator for Quality Improvement and Accreditation, and also in the DOC COVID unit right now. And I thank you once again for this monthly show that you've been, giving us this opportunity to bring our public health information out to the public. Really, it's been wonderful, Peggy. Thank you very much.
Oh, thank you. Well, that's going to do it, folks, for Peggy's Place this morning, our monthly show with Mendocino County Health. Leanne Lindsay behind the scenes, thank you as always. And we're going to say goodbye. We're now going to run down to Albuquerque, New Mexico for Native America Calling live from Albuquerque. This is KGUA in Wallala, 88.3 FM. And Ms. Wingwoman, are you there?